Hey guys, welcome back to Medical Coding with Blue. Today's episode is going to be prerequisites for medical coding school. Do you need to have anything prerequisite before you start? What if you have no experience in medical at all? Are you still able to do this? Is age a factor? We're going to be talking about those today. So before we begin, if you haven't had a chance to, I hope that you will subscribe and share my channel with fellow coders, with any medical coding students that you know. This way, all of this information that I'm sharing is all of my experiences and all of my thoughts on just anything and everything that has to do with medical coding. So I hope that you'll be a part of my journey with me, and let's go ahead and get started. All right, so the question was, is there any prerequisites to medical coding schools? I have good news. No, there is not. There is not. When you are just brand new and starting out and you are wanting to get into medical coding school, the good news is all you need is a high school diploma or a GED. I had zero experience when I first started. I mean, when I got into medical coding school, I didn't even know what medical coding even was, okay? That's how I was back then. I had no idea. I was so far away from doing anything medical when I first got into medical coding school that all I knew was that I liked to study. That was the thing that I knew. That's the thing that you have to have, though. You have to have discipline, and you have to be willing to study. You have to be willing to say to yourself, yes, I am an adult. There are some things that I don't know, and it's going to take me a little bit extra time, but I can learn it. As long as you have that kind of can-do attitude, you are already on your way. A good habit to have is investigation skills. You have to be able to look up things on your own. You have to be able to find answers by yourself. Yes, you can ask questions. This is why I have Q&A Tuesday on my channel every Tuesday. I take all the questions that have been submitted and I put it in an episode. So it's just random things. It is a coding soup, if you will, of just different topics, different questions. But yes, you can ask questions, but basic, simple questions really you need to try to figure that stuff out. It's the detail stuff is where I come in and where I don't mind sharing and where I like to talk about anything when it comes to details. That's why I like detailed questions. If you are in this period right now of you can't sign up for school yet because everything's on a freeze, it's okay. Some of the things that you can do before you sign up for a program is start studying medical terminology. Start studying anatomy, physiology, and pathophysiology. And if you get all of those out of the way, then you can start looking at pharmacology. You're just basically looking for the broad strokes of how to begin. And you can use any anatomy book, or you can use anatomy flashcards. I really recommend that if you're going to do medical terminology, like practice with medical terminology, write your own flashcards, because that will really help you. Learn the prefixes and suffixes of what they mean and that kind of thing. So that's what you want to practice and start looking at before you begin a program. This is not a prerequisite. If you have zero experience, zero background, you will be fine when you get into the program. Another question that I get often is what they teach in the program enough to get you to pass the exam? So any exam that you sit for, whether it's with the American Health Information Management Association or the American Academy of Professional Coders, whatever program that you are sitting for, right? And they will be able to tell you when you start your medical coding program what credential you will be able to sit for. Everything that is covered in that program is designed to cover the basics of what is on this test. This is why they have exam prep manuals. This is why they have schools like that or online programs. If you're interested, both associations have online programs. I will say this. As of this date, which is April the 3rd, 2020, currently AHIMA's Coding Basics course is under repair, so they are not having anybody sign up for online courses right now. You have to keep checking back with the website. I would recommend maybe probably at the end of the month. It may not even be that long. You may be able to check in a couple of weeks. But this is just to give the program time to get worked out and all of this stuff. So before you sign up for a program, if you're wanting to go through the American Health Information Management Association, make sure you call the customer service hotline. They have plenty of ways to get a hold of somebody from customer service to find out if their program is up and running. AAPC, I know they have their online program as well. I am not a member of them, but I do visit their website often because of my channel. Because whenever I want to share information, I want to make sure that the information that I share is comprehensive. I try to be as neutral as I possibly can. This is why I give you guys both association information so that way you can decide for yourself. Both associations have their own positives, and of course everything has its negatives as well. So look into the association that you want to belong to. Look and see what they offer as far as like their credential holders and that kind of thing. With AAPC, they have benefits to taking their exam. With AHIMA, their exam structure is a little bit different. So you have to check the website and you have to be able to do your research so that you know which program you want to do. If you want to study beforehand, before you sign up for a program, that's totally fine. But don't let this be your deterrent, and don't get too overwhelmed by trying to study a bunch of things. You will get this coverage when you are in the program. Now, they have structured programs, right? But the critical thinking skills is going to be hugely done on your part. It depends on where you're going, because some trade school programs, they say, oh yes, we have an instructor, and this instructor, is a certified whatever, and they're here to teach you. And then sometimes you get into that class and it is a instructor up there proctoring from a book, not really giving you those questions to provoke that critical thinking. Critical thinking is so crucial, and I even did a video about this, and it I mean, specifically on this topic, that how important critical thinking is. Sometimes people don't really think about these things because it's so much that we have to learn. Think about it, and don't let this overwhelm you. We have to know essentially what doctors know without ever having gone to medical school, right? I mean, we have to know the disease process. We have to know medical terminology. We have to know all the procedures. We have to understand what they are and what they do, and a bunch of things. We have to understand all of these things, and we've never been to medical school. So this is why I say it's a constant learning process. I've been in this field for over a decade, and I'm still learning. And every year, as I start to learn more and I start to dig more, I find myself studying more and more. Now, not everybody is like me, and there are some coders that when they get done and they get their credential, they get in their clinic and that's it. They stop studying, they do the same thing over and over again, and they never stretch themselves fully as a medical coder. And to me, that's very unfortunate, because not only does the patient lose, because maybe this same code that's getting reported all the time is actually incorrect. And if the coder's not paying attention and it's just pushing things on through, it has an impact on that patient. It has an impact on the facility when the insurance company comes knocking and says, oh, we've been overpaying you, we need our money back. It impacts the provider, because then they get either a deflated or inflated sense of how much production they're actually doing. So this is why it's very important to be able to ask those questions and know and learn and understand what questions you need to ask. This is why I spend a lot of my videos talking about these little detail things. And I always try to encourage anybody that wants to become a medical coder, but I do tell them that it is difficult. This is not easy. And if somebody is trying to sell this field to you and they tell you, oh yes, it's easy, and you can just get a job anywhere, and you can work from home, and you can work at a doctor's office, and you can just punch in a few keys and there goes your code. No. You actually have to look and think about what you're doing. And then if the documentation is not complete, if it could use more clarification, then you have to learn how to speak to a doctor. And a lot of times with these doctors or the PAs or the nurse practitioners, some get very hot when you tell them, well, I'm coming to you because I'd like to talk to you. Oh, really? How dare you? I'm a doctor. I'm a surgeon. I'm a this. I'm a that. And I have to listen to somebody like you who has a high school diploma or a GED and a credential? Really? This is where you have to learn those other skills. You got to learn good people skills. You got to be able to work with these alpha personalities. Okay, so if you're wanting to get prepared, even if you've signed up for a program and you want to get prepared even more, that's something else that you can look into. Body language. Now, I have my Instagram page, which is Medical Coding with Blue, all one word. And in there, I show you the pictures of the books that I have in my own personal collection. I study. This is what I'm telling you guys. To be comprehensive, to be a comprehensive coder, it's going to take more than just knowing your anatomy, physiology, medical terminology, and pharmacology and pathophysiology. It's going to take a lot more than that. You want to be the entire package. So you got to be able to read a room. You got to be able to speak clearly. And something else, if English is not your first language, I'm going to tell you this right now. You will struggle. Because if somebody who speaks English, I struggled too. And I'm a studier, and I study, and my vocabulary is quite extensive. And I still struggled. So I know if I struggled, somebody who has a language barrier is also going to struggle. So I'm just letting y'all know that right now. If you have a difficult time with the English language, please work on your English language comprehension, especially reading comprehension, because that is 100% of what you need. If you can understand all these words, but the second you can't put it together and understand what is being documented, that's when there's an issue. I've seen people who have issues with the English language confuse cardiac lead and lead poisoning. That is two separate, different, complete polar opposites. That's not even in the same radar. And it was picked up that way. Luckily, an auditor caught it. I'm just saying. So this is very, very important. This is some of the things that you need to know. Your language, your grasp of the language needs to be clear, because again, it's going to fall back into harming the patient if you are misunderstanding what is being documented. Okay? If you are intimidated by these huge, big, long medical terminology words, don't sweat it, because we were all there. Trust me. And I still look at some words and I'm like, okay, what the heck does this word mean? It takes study and it takes dedication. If you are worried about your age, I talk about this a lot too. Some people think that I just turned 30. Am I too old to do a new career? No. You are not too old to do a career. I turned 40. Am I too old to do this? No. You are not too old to do this. I'm in my 50s. Am I too old? No. No, you are not too old. And do you know why I say you're not too old? A woman that I knew in school was in her 60s, went through the school and graduated. And she's still a medical coder today. She's in her 70s. If she can do it, and not only that, she survived going from ICD-9 to ICD-10, which if you've been through, or if you know somebody that's been through that, trust me, it is complete night and day difference. Completely, right? With a diagnosis coding. Now I feel like I have an eyelash. Ooh. So if they can do it, you can do it. Okay. The thing is, this is all too about confidence and not really getting so down on yourself if you don't understand something, or if you immediately become intimidated. Okay. You've got to really learn to get a handle on being intimidated, because it's going to continue to happen even after you've gotten your credential, even after you get into the field, because then you have this other hurdle, right? You got to go through audits. You got to go through regular medical coding audits. Now, audits is a very scary word. Yes, we've all heard audits. Ooh, it is scary. It's a scary word, but it's nothing to be afraid of, because it is, in fact, a fact of life when it comes to being a medical coder. You can learn from audits, and audits are a very valuable learning tool, because sometimes people can see things that you weren't able to see. So if people can see things that you weren't able to see, it makes you a better coder. And you have to learn how to take criticism, because you will get it. Okay, I even get it. I get it at work, and I sometimes get it here on my channel. But I do block people who are overtly negative, because I don't need that, because I'm not here for negative people. I'm here for the positive people, and I'm here for the purpose of sharing my knowledge. You know, there are not a lot of us medical coders that do this on a regular basis on YouTube. I'm just saying. And to have somebody who wants to share, I think, is more important than any other thing, you know, where of somebody who wants to be negative. Okay. I do not surround myself with negative people at all. That is a standard for me. I soak up other people's energy. And I'll tell you what, if I have somebody around me that's negative, I immediately go away. Do you know why? Because there is no sense in wasting my time around anybody that is negative. If you're going to be negative about yourself, I don't think I can do this, and I should just give up. Why? You wanted to get into it. Why would you think that way of yourself? Think positively, because the only one who's going to be able to have your back when you're sitting there in your exam is you. You're gonna have to be the one to say, I can do this. I can pass this exam. And when you get out of school and you pass that exam, now I've got to find a job. Because I'll tell you what, that's another kick in the pants. I'm not kidding. If somebody tells you that it's real easy to find a job in medical coding, nope. It will put up a fight, and it will be ready for you, okay? Because medical coding is one of those really weird professions. They need you, they want you, but they won't take you if you don't have experience. But how are you supposed to get experience if no one will hire you? This is where you have to try to do other things. If you can't immediately get in the field one way, then you can try to do medical records, medical billing, and that kind of thing. And another thing, before I get off into that, medical billing. A lot of people say, well, I only want to do the coding. I don't want to do the medical billing. Why do I have to take the course? It is part of learning to be a medical coder. You have to learn about medical billing. I learned about medical billing when I was in school. Am I a medical biller? No. Have I ever been a medical biller? Nope. But I do know a lot about billing. I know a little bit more about billing than I did years ago because of my own private research. And to understand billing and being a medical coder is very important. Now, the technical knowledge for a medical coder and a medical biller is two separate things. And I really hate it when people try to make it synonymous, because it's not. A medical biller and a medical coder can be the same person, yes. However, more oftentimes than not, they are two separate persons, right? So the medical billers don't have to have a credential. Now, I know that there are credentials out there for it. Some other association offers it. I have never seen anybody ask for that, and you do not have to be certified, or you do not have to have a certificate to be a medical biller. To be a medical biller, all you need is a high school diploma or a GED. That's it. And basically, all you're doing is processing paperwork that comes from the medical coder to the insurance companies. You have to know how to fill out forms, and you have to know how to submit claims and that kind of thing. That is the job of a medical biller. A medical coder has to know anatomy, physiology, medical terminology, diagnosis coding, procedure coding, they got to know all that. They got to know the rules for that, not the biller. Do I think billers should know what medical coders know? Heck yes. But that's me. That's my opinion. But they don't have to. And I say this because at my facility, when I get a message from the billing company, from the billing side, and they say, "Oh, you have an error." Oh, really? So, and I show them in the book how I don't have an error. Oh. So before you try to correct me, let's make sure that we have the correct information, right? So I've taught the billers a lot about medical coding. Okay, so I mean, not to be like that or whatever, but when you are trying to find out answers, you don't always tell people that they're wrong. Okay, I'm just saying. So if you are learning medical billing as part of your course for a medical coder, and it'll say sometimes that the course is called Medical Billing and Coding, okay? It doesn't necessarily mean that you have to be a biller. All right? So we've covered it all. We've covered that you do not have to have any experience to become a medical coding student, right? You can be any age that you want to be, and you have to have it in you in order to have the discipline, go through the program, study, pass the test, and take the hits when you are out there trying to get a job. And if you are trying to get a job and you say, well, I only applied at 3 or 4 places and I haven't gotten any calls back, honey, you need to go to 20 and 30 and 40 different places and apply. Because applying at only 3 or 4 different places and then sitting on your can waiting for them to call you back is not going to cut it. You have to be out there and you have to be proactive. I did do a video about entry-level medical coding job listings and what they mean. I'm going to try to look for some more because I think you guys really like that. But breaking it down to understand what it means is really very important. But I know if I could find those jobs, guys, you can find those jobs. And these were everywhere. And this is not an endorsement for Indeed, but I did find them on Indeed. I'm just saying. If you want to get into a medical coding program, and right now, because of the freeze and everything, or if you're trying to sit for an exam, everything's on hold right now. Everything. So again, if you're going through the association, go and call their customer service hotlines. Make sure that either their programs are up and running to take the medical coding course, or when will they have their testing up and running again. Guys, honestly, I think it's going to be a little while before anybody can sit for an exam, okay? So don't let that deter you either. Continue to study. Work on your speed when you're looking at documentation, okay? So that's my advice on that one. So we've covered it all, okay? But yes, there's no prerequisites. What you get covered in your course is going to cover you for that exam. But you still need to do supplemental studying on your own, okay? Don't just rely on what they're giving you in the program to say, oh yeah, this is sufficient enough for me to know in the knowledge department. Get you some anatomy flashcards, make you some flashcards, handwritten flashcards for medical terminology. And don't scoff. Some people have scoffed at me. Really? Handwritten flashcards? I'm telling you guys, when you write stuff down, it commits it to memory a lot better. Okay? So, I know it's a lot, but I'm telling you guys, it's exciting. And I love it. And right now I'm working at home because we are working remotely. All the coders in my hospital are all working remotely. And I'll tell you what, I can't wait to get back. And I'm working remotely not by choice, trust me. If I had my way, we all would not be in this right now, but we are. So I just have to deal with it. But to me, it is the best field. I've been in it for over 10 years, and I have not gotten bored. And the passion for it grows every day. You got one life, people. And whatever field you decide to choose, you got to be happy with it. And now sometimes you may not be so, oh, what did I get myself into at first? But trust me, if you stick with it and you keep learning about it, the better it'll get. Okay? So, I'm going to go ahead and wrap this one up. But I will be filming more this weekend. I will be, my next video will be at 7:30 tomorrow. And it will be about the credentials. I'm going to be breaking them down again. But I'm going to do a different approach. Okay? So tune in for that tomorrow. We'll be talking about AHIMA and AAPC credentials. So I will see y'all then. But I hope you've enjoyed this. If it helped you, please like it. Please share it. Please comment below. Let me know if you have any questions. And I'll be leaving my email address down in the description box below. So I will see y'all next time. Bye.